Hi, I'm Claire Doherty, CEO of Brem Foundation to Defeat Breast Cancers. Welcome to Check Out My Rack, Brem's annual digital event featuring inspiring speakers and actionable information to help you take care of your breast health. You may have heard the news that cancer is on the rise in younger people, particularly for women under 50 years old. In fact, in January, the New York Times ran a significant piece on the topic with the extraordinary headline that you can see here, Cancer's New Face, Younger and Female. We've also known for quite some time that younger women, particularly Black women, often get aggressive, harder to treat cancers, such as triple-negative breast cancer. Researchers are working to understand the causes for those trends, and we'll hear more about that tonight from one of our panelists, Dr. Mohan. But we do know one thing for sure. These troubling figures require all of us to prioritize our breast health in various ways, such as learning your family history and other risk factors, and doing breast self-exams. And knowing that based on your personal risk profile, you might need to start mammograms earlier than age 40 and require additional testing. Before kicking off our program, I wanted to share briefly a little bit about Brem Foundation to Defeat Breast Cancer and our unique efforts to push for early detection. We do our work through three core pillars, with innovative education programs, like the one you're on tonight, equitable access programs that help some of the most vulnerable community members, and targeted advocacy to level the playing field in breast cancer, working to address long time and significant disparities. And now for some thanks. A heartfelt thank you to our amazing panelists. You will not be disappointed. You'll be hearing tonight from Andrea Hans, Katrina Marcel, Annie Bond, and Dr. Akansha Mohan. And we couldn't have put together this program without the generous support of Eli Lilly and Company, our early detection sponsor. Thank you, Eli Lilly and Donna Hopf, our supporter there. And finally, a special shout out to our wonderful collaborator organizations who helped Brem Foundation to spread the word far and wide about Check Out My Rack. You can see here over 20 amazing entities up on the screen who are all wonderful partners in our early detection work. Much gratitude to all the organizations on this screen and all the people behind these organizations. You know who you are, and we value your partnership deeply. So in just a moment, we're going to share a short Brem Foundation video about breast density. It's very compelling and sheds light on breast density, which, as many of you know, or some of you may not know, is an independent risk factor for breast cancer. After the video concludes, I will turn the program over to our accomplished Brem Foundation champion, Athena Jones. We've been fortunate to have Athena lead the last few years of Check Out My Rack, and we are so grateful that she's back with us again. Athena Jones is a journalist with more than 2 decades of experience working in wire services and in print and broadcast media. She began her career at Bloomberg News, covered national presidential campaigns, and spent 13 years at CNN as a White House correspondent and national correspondent. Athena is a breast cancer survivor diagnosed twice in her 30s and is co-directing and co-producing a feature documentary on Black women, breast cancer, and health equity. So with that, I want to thank you all for being here. Enjoy the video, and afterwards, Athena will kick off our formal program. Thank you.
Can you spot the cancer on this mammogram? It's right there, pretty easy. This is a mammogram of a dense breast. Can you spot the cancer here? It's hiding right there. It's hard to see, and that's because of all this dense breast tissue. It's like trying to spot a particular cloud in an overcast sky. Cancer is so hard to find in dense breasts that dense tissue hides up to 50% of cancers on a mammogram. That means if you have dense breasts, your cancer could go undiagnosed. Not great. So the big question is, do you have dense breasts? Well, you could. Dense breasts are actually pretty natural and normal. Half of women over age 40 have them. They can be in large, small, perky, or saggy breasts. You can't tell if you have dense breasts by how they look or feel. There's no DIY kit from the store. Your horoscope can't tell. And there's no app for that. The only way to tell is to get a mammogram. When your results show up in the mail or a web-based portal, they should tell you how dense your breasts are. Sometimes they don't, and if that's the case, you should call your doctor and ask. So what can you do if you have dense breasts? Great news, you can ask for an ultrasound. It's not just for babies. On an ultrasound, the dense tissue is still white, but the cancer is black, making it easier to see. Kind of like that one friend you had growing up who was terrible at hide and seek. I can see you, Sarah. Breasts range in density from level A, not so dense, to D, extremely dense. If you have extremely dense tissue, an MRI might be helpful. MRIs are like the Sherlock Holmes of detecting cancer in dense breasts. But it's not right for everyone, so talk to your doctor. Do you have dense breasts? Find out. And if you do, ask for an ultrasound or MRI every year in addition to your mammogram. In some states, insurance must cover breast ultrasounds and MRIs. If yours doesn't, talk to your doctor or navigator for next steps and options for support. This can't happen without you, so be brave and advocate for yourself. It could save your life. If you can't remember all this information or just want more, visit breasthealthresources.org for free educational downloads.
Hello, everybody. I am so happy to be here hosting Check Out My Rack once again. As a breast cancer survivor diagnosed twice in my 30s, I care a lot about raising awareness of breast cancer risk in all women, but especially for young women. As Claire mentioned, I'm co-producing and co-directing my first feature documentary. It's called Sisters Keepers, and it's about Black women, breast cancer, and health equity. Many of us have heard the startling statistics that Black women are on average about 40% more likely to die of breast cancer than white women. And our film examines the reasons for that disparity and how to save more women's lives and help all women of all ages, better understand their individual risk of breast cancer. So thank you for joining us for this important event. We have a great group of doctors and advocates who will be part of the discussion, and there will be a question and answer session at the end, so please put your questions in the Q&A box. There'll also be a survey emailed to you after the event so you can share your thoughts. So let's get to introducing our panelists. It's now my pleasure to bring out our incredible panel of experts, breast cancer advocates, and survivors. As we discussed earlier, cancer in younger people is on the rise, and that's also true for younger women and breast cancer. So today we're going to be digging into what younger women and anyone new to screening can do to look out for their breast health. We'll learn from experts, young survivors, and advocates how to use your voice to take care of yourself and your loved ones. So our great panelists can now join me to start our conversation. Wonderful. We have Dr. Akanksha Mohan, a breast radiologist and Brem Fellow alumna at George Washington University Hospital. Katrina Marcel, the lead angel advocate at Tiger Lily Foundation and a breast cancer survivor. Andrea Hans, the public policy manager at the National Coalition on Cancer Survivorship and a breast cancer survivor. And Annie Bond, comedian and advocate and a 9-year survivor of metastatic breast cancer. So a big welcome to all of our panelists. And I want to kick off the conversation by giving each speaker a chance to introduce themselves and share a little bit more about why you're here today. And we'll have a chance to delve more deeply into your stories during the panel. So let's start with you, Dr. Mohan, and maybe you can also give us a quick preview of some of the breast health tools you'll be talking about with everyone today.
Thank you so much, Athena. It is such an honor to be here as a part of the Brem Foundation and to be especially a part of this initiative of Check My Rack. I am a Brem Foundation fellow myself. I graduated about a year ago, and I am a practicing breast radiologist full-time in Salt Lake City, Utah. Breast cancer and the reasons why it happens has always been a cause that's been close to me. I've had multiple family members, my own family diagnosed with breast cancer. And so early on in my life, I knew I wanted to do something in my career with breast cancer. Can't wait to talk more about what I know and share what I have learned in the Brem Foundation and in my career so far regarding risks to developing breast cancer. We'll be talking about what does family history really mean, how to do a monthly self breast exam, and how to talk to your doctor about getting the care that you deserve and that you need to adequately self advocate for yourself.
And Katrina, will you go ahead and introduce yourself?
Yes. Hi, everyone. Good evening. My name is Katrina Marcel. I am from McKinney, Texas. I had stage 3B triple negative breast cancer. I am 3 years into survivorship this past January. I love the Brem and their foundation and the mission, and I look forward to discussing tonight education and advocacy and the ways to use your voice best to support yourself.
Wonderful. Thank you, Katrina and Dr. Mohan. Andrea?
Hi, everybody. My name is Andrea. I think for me, when I was diagnosed, I was really surprised because even though I had an understanding of healthcare and medicine, I was surprised to really learn that it could affect me at such a young age. I really thought it was something that I had to worry about maybe when I was older, and I remember being in waiting rooms. It wasn't really reflective of like a young person's disease. Now we're seeing more and more young people affected, and I really just thought about like my friends and, what do what do they need to know? What do young people need to know, so that, they can be fully informed. And I think that's why conversations like this are so important. So I'm really excited to dive in and talk more about our experiences.
Wonderful. Thank you, Andrea. And Annie, last but not least, go ahead.
Hello, my name is Annie. I have had stage 4 metastatic breast cancer since 2015. I was diagnosed when I was only 26, and I was a comedian with a theater degree. So I was like, oh no, I have to suddenly learn so much science. And in my journey of this 10 years, I have learned so many other things, by choice and not by choice, as we all know too well in this community. One of the biggest things being that there is not enough education for young women. Even nowadays, we've pushed to doing a lot of things for women now 40 and over. And as someone who was diagnosed at 26 with no family history, I cannot help but see the huge gaps in education and actual awareness. So I can't wait to speak a little bit more about that, and especially how young women can take care of themselves and advocate for themselves in the best way.
Wonderful. Well, I want to get to that first, Annie. I want to make sure we turn to you first so that no one misses this part of the program, because you have bravely and with humor used your significant platform. You have more than 88,000 followers on TikTok to do what you just said, to educate thousands of people about breast cancer. And we know that when it comes to self-checks and being breast aware, that's important because more than 70% of women who are diagnosed with breast cancer under the age of 40, they find their own breast abnormality. And at the same time, there's been some conflicting recommendations on whether women should even be doing these self-checks. So Annie, I want to hear your views on this subject and get to the important demonstration for everyone here, which is how to do a breast self-check. So take it away.
Yeah, thank you. Well, I first of all have to say how much I loved the dense breast video, because that is one of the many things that I think keeps people from doing self exams. I think also the formality of it, which, if we're being so formal, everyone's going to feel like, oh, I'm doing it wrong. And this is something I always hear from people. They're like, I really want to start doing self checks, but I feel like I'm doing it wrong. And so my advice is to just do it. So while we're here, why don't I just do one right now? Okay. And my belief system now is to do it just as informally as possible, because the only way to do a self exam wrong is to not do it. Okay. So once a month, as you start, just start kind of grabbing around. My two rules are look and touch. Obviously, when you do it, you will not be wearing a shirt, but for the sake of the Brem Foundation's reputation, I'll keep mine on. So we'll start by looking. You can stand in the mirror, kind of put your hands here, look side to side. Make sure you lift up if you got big uns like me. You want to look underneath, just kind of look around, turn, put your hands over your head, look at that, and think like, oh yeah, look at this beautiful body, everything she's doing. We're looking for abnormalities. I know when I had my lump, you could clearly see it on the side slope of my left breast. So that was one of the beginning signs. You're also looking for any kind of skin changes, nipple discharge, always fun to say those words. And then step two, we're going to touch, okay? I like to do spidey fingers first, is what I call them. If you have a spider phobia, you could call them magic fingers. But just kind of using your fingers and pressing down in, especially I have very dense breasts. It's been one of my biggest risk factors. So just making sure that you really kind of get in there and feel all around. Again, underneath, I feel like is a really important spot that a lot of people forget. I have a good friend who found her cancer when she was lifting her breast in her sports bra, as we all know that really well. And then I would go Spidey magic fingers and then sweepy fingers. So you're just kind of going slow and sweepy underneath, all around. And literally, if even that sounded too intimidating, if you just look in the mirror once a month and just feel around, that's a good start. What you're looking for, I think, is something people also get intimidated by. They're like, I don't know what I'm searching for. I feel like I feel something weird. It's normal to have some kind of lump, some kind of thickness, but what you need to get to know is what your normal is. My lump was very obviously something weird. It kept growing. It was hard to get it looked at, and I wish I had been doing more self-exam tutorials. But most of the women I know under 40 who have found their own cancer, which again is the majority of us, it's been through some sort of normal lifestyle thing, like adjusting a bra. My ex-boyfriend had found mine, which is a bit of a mood killer, I will say. I'd be like, there's that big lump in there. So the important thing is to just get to know your body, to not be afraid of it, to take notes. If you still have a period, I've been in menopause since I was 26. Fun fact. Kind of just keeping note that your cycle can change the feeling of your breasts. And if you do feel something weird, go to a doctor, get it checked out, advocate for yourself, have a little note on your phone or a little notebook. But just check in with your body at least once a month. Grab around. Shower's a great place, in the bathroom, and anything you do that is a step toward taking care of your breast health is the right thing to do. And if you have questions, you can always ask me because I will answer them. Let me put my shirt back on.
Thank you, Annie. I think it's so important that women get to know their bodies and what's normal for them. And certainly self checks are a part of that. I want to get to the sort of the big topic that brought us together and why this conversation is so important, which is this news lately that breast cancer in younger women is on the rise. So Dr. Mohan, we have so many questions for you, and we're going to try to pack in a lot of information in a short period of time. And I want to remind everyone that we're going to have a Q&A at the end. So put your questions in the Q&A box, and we'll try to get to as many as we can. But Dr. Mohan, starting with the burning question, at least for me, as Claire referenced earlier, we've heard so much in the news in the last several months about cancer being on the rise in young people, different kinds of cancer, but also breast cancer, maybe particularly breast cancer when it comes to younger women. So can you start out by telling us why breast cancer is on the rise in younger women? And then I have another question for you.
Yeah, thank you, Athena and Annie. That was an awesome demonstration. Really big question, really important question, and a hard one to answer. So from 2012 to 2021, breast cancer rates overall have been increasing by about 1% every year. For women under 50, that number is higher at about 1.4% per year. That number is even higher for Black women in their 20s. Why this is happening is, even for me after having studied this, it's hard to understand, and it's probably a result of multiple causes, which we'll talk about briefly. I want to stress that young onset breast cancer is more aggressive, it's harder to detect, and it is associated with lower survival outcomes. One theory that's currently being looked at is an increased lifetime exposure to estrogen, with trends of girls starting their periods earlier, women going into menopause later, and fewer women breastfeeding or choosing to have children at all. Diets rich in processed foods, red meats, and alcohol are becoming more common, as is more sedentary lifestyles for all of us, and increased weight gain. Some studies are looking at environmental toxins like microplastics and other chemicals that may be out there, which may be contributing. All of this being said, I again want to emphasize that not one of these causes has been implicated to be the only cause or even a true cause yet. If you have been diagnosed with breast cancer, it's not your fault, and none of these causes are any that you could have prevented or is in the control of any one person. Our purpose here at Brem and in this webinar is just to provide information and as much information as we can so that you can be the best equipped moving forward. A really important question. There's a lot of teams around the world working on this question, but those are just some potential answers.
So much more to learn about why this cancer is striking more and more young women. But since women under 40 who are at average risk are not recommended to have mammograms, what can they do to look out for their breast health?
Absolutely. So just like Andy just went through, do a monthly self-exam. There's no wrong way really to do it. Be aware of how your breasts feel and how they look. Live healthy, kind of like what we just talked about a little bit. Exercise, get outdoors, limit your alcohol intake, avoid tobacco. If even if you think that there may not be a family history, find out more, dig deeper, and figure out if there is cancer in your family because that can affect your risk. If you find that there is cancer in your family members or in past generations, even if it's not breast, then talk to your doctor about genetic counseling. If you are of a higher risk population, if you're Black or Ashkenazi Jewish, consider doing a risk assessment to understand your risk better. There's multiple risk calculators on the internet. We have one on our Brem Foundation website, and use that to understand your risk more. It may be that you may qualify for a screening mammogram earlier than the standard age of 40, maybe even as early as 25. And this cannot be emphasized enough, but self-advocate. If you feel that there's something off, if you feel that there's something different, if you just have a gut instinct that, I think there might be something going on, talk to your doctor about it. That truly cannot be stressed enough. If you feel like you're not heard or if your doctor disagrees with you, then get a second opinion.
Thank you, Dr. Mohan. And you talked about family history and genetics. Katrina, we just heard about the importance of and influence of genetics and family history on whether you're likely to develop breast cancer. I know that genetic mutations in family history can increase an individual woman's risk of getting breast cancer. And this is personal for you. Can you talk to us more about how genetics play a role in your story and what you most want people to know about it?
Absolutely. Thank you. Yeah, exactly. So, Dr. Mohan, for me, learning that I had the BRCA1 gene mutation was totally shocking. It's a lot of times where those important family conversations don't happen. And that's a situation that happened with my family because my father was adopted. So, going through that deep dive, like Dr. Mohan said, was something that I had to do because I have a little sister coming behind me. And because I was diagnosed and I have the gene mutation, she also got tested and learned she had the gene mutation. So it became vital for me as being that vessel to find out the importance of information that was necessary that our family just wasn't communicating. And so with learning about my family and doing the whole ancestry and just diving deep, I found out that my dad's biological mother had breast cancer at 36 and passed away. And being the first daughter, I diagnosed it at 37. So it's a lot of importance of conversations that we're not doing that truly need to happen, because if they don't happen and women continue to be diagnosed at these younger ages, then what is there next to do? Because communication is key in all relevance of disease. And so it's very important. And I want people to know that if you see or know any type of cancer or disease is in your family, if you're writing that on your patient information form that you hand to your doctors, make sure that you advocate and say, hey, I'm concerned. I need to know and would like to get tested to see if there are any diseases or mutations that are within me, because getting everyone to talk is like twisting needles. And I try to have my family talk, but it's hard to do because people don't want to tell you what Aunt Jane had or Uncle Robert had. And it's just like, we have to do something to ensure that we have a future and healthy bodies for ourselves.
Thank you, Katrina. No, it's so important to be talking about this. There's a certain stigma and kind of taboo in some communities and some town and families that don't want to talk about these kind of difficult conversations. But I think the more we talk about it, the easier, hopefully, it will get for people to kind of be able to share this kind of information. I also know that a lot of young women go in and they think there's a problem, but they're dismissed by their doctors who say, you're too young. So, Andrea, I want to hear what you have to think about this issue of young breast cancer patients, frequently being dismissed. This may cause their diagnoses to take longer and take longer for them to be diagnosed. They might discover the breast cancer they have at later stages. After hearing too often, you're too young, you can't possibly have breast cancer. Can you speak to this issue of you're too young and how you've had to advocate for yourself and what you recommend others do when they encounter this sort of situation?
Sure. First of all, Annie, that self-exam was fabulous. But it reminded me of when I found my lump, because a lot of us, we find our own lumps, right? Because there are no guidelines, and for those of us who are under 40. And so by the time I had found my lump, it was over 3 centimeters. And I went to the doctor, and he had said that it was probably nothing and that I didn't need to worry about it because I was young and had no family history. And so I asked for an imaging test anyway, and that's when I found out that I had dense breast. So I think it's, when you already find a lump and you're already scared and then you're dismissed, I think it creates a barrier for a lot of people that don't know to ask for things. And what I've found in speaking to a lot of other young people is that this is not unique. My story is not unique. A lot of people have been told that they're too young. A lot of people have been said it's probably nothing. It's probably just, a normal change or whatever to come back later. And had I waited longer, it would have been a worse prognosis. And so I'm really glad to hear that there is increased provider training to deal with younger people and the younger incidence rates. But it's I also tell I think it's I remember sitting at a table with seven or eight of my friends, because we know that 1 in 8 women will be diagnosed, right? And so I remember sitting at the table and I just looked around at all of my friends and I thought, I hope that I'm the only one who ever gets cancer, because I don't want them to go through what I went through. And it's and that's why I want everybody to know what risk factors are relevant to breast cancer, and to talk about like family histories. My family, they went through genetic testing, and we started talking about like cancer in the family, but it's all of these conversations are so important. So what I think is important is for young people to know that just because you're young, it doesn't mean that cancer might not touch you, but also, know that you have a right to go to a different doctor if you feel like Dr. Shama say, if you feel dismissed.
Absolutely. That's important. I mean, to always be able to speak up and to bring someone with you, perhaps, if feel like you might not be able to speak up on your own. I want to hear about what you think about this from Katrina and Annie as well, in terms of your take on younger women being dismissed and how you have had to advocate for yourselves in your individual situation. So go ahead, Annie.
Hello. The first thing I wanted to say is that being told you're too young for cancer when you are in your 20s and a doctor's never done anything but be correct is very confusing because I'm a people pleaser at heart, which I've gotten to be less of as someone with cancer. But I believed the doctor when I went in and she took a look at my noticeable lump. I also had some swelling in my armpit, which, oh, don't forget your pits. That's one thing I forgot to say in my self-exam tutorial because I just thought This one's just gaining a little weight somehow, but not this one." That wasn't it. It was my lymph nodes were swollen because the cancer was spreading there. I felt like I was very let down by the medical system that I trusted because I did go in pretty much right away. And it took me 9 months to get a doctor to take me seriously, even with a very visible lump, because I didn't have a family history. We didn't know as much about dense breasts or talk as much then in 2015 about how that could affect an early diagnosis. And the other thing, the Brem Foundation is all about early detection. And that's something that you might think somebody who was diagnosed stage 4 cancer right away, like in that 9 months, as I was trying to get a diagnosis, my cancer was mutating to become more aggressive, had spread to my liver. And so you might think like, "Oh, well, why are you here talking about early detection?" Well, of course I am, because my God, we have to detect earlier. That is the most important thing. It does save lives, but at the same time, we can't ignore the fact that young women are usually diagnosed with more aggressive breast cancers. We're usually diagnosed later, so we are ending up metastatic more often. So we have to equally include women with metastatic disease into the conversation because that is the only type of breast cancer that you will die of. And my first oncologist, who was not the best, and because of that, I'm actually grateful because he forced me to go get another opinion and another opinion. And I learned in finding all these opinions, wow, treating cancer is, yes, it's a science and it's also an art because we don't know what's going to work completely. And what we need are options. The only way that women like me who live with metastatic disease lose our lives is when we run out of options. So it's really looking at, yes, we need to educate and see, but we also need education around everything, including that young women are dismissed, that you need to trust your gut, and that I heard a woman who survived metastatic disease for like 30 years in England was talking about being a cantankerous patient. And I just think that's, first of all, just a fun word to say, cantankerous. But anytime I feel I'm being silenced, I kind of get this fire in me because I know that I had to work to save my own life, that the system is set up to miss us, unfortunately, and that we really, really, really have to fight for ourselves. And my God, worst case scenarios, you have a lump, you go get it looked at, you feel like you're being really difficult and you find out it wasn't anything. Well, that's a wonderful situation. And if you find out it was something and the doctor's like, "Gosh, she's annoying," who cares? You're alive. Be annoying, be cantankerous, and also just don't ever lose hope in us stage fours because we are working real hard. And yeah, I'm happy and lucky to be here, but I also know that I fought a lot to be here, and that if I wasn't a bit cantankerous, I might be in a very different situation. So if a doctor ever tells you you're too young for cancer, please tell them, "Hey, that's factually inaccurate." And my friend Annie is living as my worst nightmare to be an example that you can give to a doctor and be like, "My friend Annie was diagnosed at 26 with no family history, ended up stage 4. Can you just check? Can you just give me an ultrasound?" Because that was the hardest thing for me to just get access to financially, getting it covered by insurance, and even just getting a recommendation at all. So fight for yourself and use me as your example if you need to.
Be cantankerous to try to preserve your options. I think that's so important. The earlier you detect
Yes.
cancer, the more options, treatment options you'll have. Katrina, you've spoken openly about the hurdles that women of color often face in speaking up and advocating for themselves with doctors and medical providers. Share your thoughts about those challenges.
With those challenges, what I've experienced is, you know, it's just it's not true, or what we're experiencing, we're overthinking it. And if we try to come in just a little not aggressive, but aggressive because we want to be heard, we're taken as the angry woman. And sometimes, that makes you look and like, look, I'm being honest. I'm telling you the truth. This is my body. I know my body better than you do. You don't even know me. We're just meeting. Like, listen, right? Always tell my doctors, what if this was your daughter, your mother, your auntie? Come in my position here. And I always say that in those types of scenarios, I've been dismissed a couple of times. And the dismissal, I've always told my doctors, you should have better bedside manner when someone comes to you with an issue. It's been situations for myself where I told my doctor, hey, I lost my primary insurance. And it was immediately, oh, I can't see you anymore. And I'm like, well, wait a minute. I just told you I lost my job in one sentence and I lost my insurance in a second. And then you just told me you can't see me. I never said that I don't have insurance. Don't dismiss me because I didn't finish everything I was trying to tell you. And then just being dismissed by my first plastic surgeon who was like, well, if you don't know you want a mastectomy or a lumpectomy, I can't talk to you. We haven't even gotten that far. Like, I just wanted to talk to you to know what the options are and what you think may be best because I'm triple negative and it was in my lymph nodes as well as in my breast and it's aggressively growing. Like, I'm trying to understand what's best for me. So being in those types of situations made me get strong and know that my voice was my power. It had to be because of who I am and what I needed to do for me. My family's looking at me. My family's depending on me. They don't know what to tell me at this point. So I had to tell myself something and the grace to get together to have people not dismiss me, but hear me.
I mean, it's a matter of life and death being heard, right? Making sure that you aren't dismissed. We've been moving quickly through our prepared questions, but I want to ask this question of everyone. We'll start with Andrea, but there are unique challenges for younger women with breast cancer. Being a young breast cancer survivor has its own challenges. And Andrea, you've not only lived through this, but you have to encounter these issues as part of your work. So can you share your perspective about how age affects your breast cancer experience? And then after Andrea, if anyone else wants to jump in.
Oh gosh, I know we don't have a whole lot of time, so I'll just say financial toxicity, the cost. I mean, that was literally my first thought when they told me that I had cancer. I was like, no, I can't afford it. Like, like, no, I can't. I don't have time for this right now because it's expensive. It's so expensive. I knew that I was gonna have to take time off work, and that affects my insurance. And then, okay, like disability, like it's just when you're older, you're in a different financial situation than you are in your 20s. And we don't have like you're not on Medicare, so it's a different like it's commercial. It's just so complicated. So I was just like immediately cost. And then like you're just starting out in your career. So now where does that stand? And or like you're finishing school. And I mean, I moved back in with my parents. And I mean that it's just so different. It's so different. Then you're dealing with your fertility and I mean, it's heartbreaking, and that's not covered by insurance. I mean, may or may not be. It just depends. And again, that's cost. I mean, everything was just about cost, and it made me so angry, and I'm angry for other people. And so there are very unique. I think your friends are also at a different place too. In your, when you're young, you're in your 20s, 30s, whatever. Most of my friends were going to music festivals, or I don't know what they were doing. But I was dealing with cancer. Nobody wanted to talk about that. And I was, so it was very different. It was very, very different, I think. Yeah, and then I'll open it up to anybody else who has anything else to add.
Yeah, I just wanted to add on that, especially at the end there. It's the for me, like being 26 and feeling like, I'm trying to be a comedian as well. It was like, oh, this isn't funny. Like, this isn't cool. And I began to feel very isolated and alone because even when you're at the cancer centers, when I was doing radiation, it was basically me and a bunch of men in their 60s who needed to close the back of their gowns as they were walking away. Um, but I just felt like I was the only I felt like an alien at the hospital. And anytime I'd see somebody near my age, I just want to run up to them and be like, "Are you also sick? Can we be friends?" But that feels so weird because you're all in this vulnerable, awful place. Or I'd see a woman with a shaved head, and I had to learn the difference between bald and shaved, and be like, you can't just run up to people. And then just feeling like, all of these friends that you've had for years, that you can't relate to anybody anymore. And it's so hard to ask for help when you're already asking everyone for help, for your physical everything to be taken care of, to have your rent paid, like all this financial stuff. Don't think that you're a burden, and don't ever think that you're burdening anyone by needing more help mentally. And I wish that I had known that earlier, had gone to a support group earlier, because the minute I walked into one of those, that I was brave enough to say, I need help. I'm feeling so lost and alone, and it's a dark place and I don't like it. The minute I was in a room with other young cancer survivors and they were saying things in my head that I hadn't even said out loud to anyone, I realized I wasn't alone, and that there is so much support and there is so much hope. So just I know that feeling of being a burden and being sick and focusing so much on your physical health is overwhelming. Just don't forget your brain, because it's so important, and your beautiful little heart. So take care of your mental health always.
Thank you, Annie, and thank you to all of the speakers. This part of the program went by so quickly, but we do still have the Q&A, and we have several questions that have been submitted. I want to start with you, Dr. Mohan. When it comes to dense breast, is it best for women with dense breasts to get an MRI or an ultrasound along with the mammogram? And if so, what's the better choice? Is it MRI better? Is an ultrasound better? Does it depend on what your insurance covers? How would you approach it?
Yeah, I'm so glad we're talking about this. And it's breast cancer care is personalized now. And so it's a great conversation to have with your radiologist at the time of a mammogram, or with your doctor. If you have dense breasts, which about 50% of women do, you're both at an increased risk of developing breast cancer, and also at an increased risk of having that cancer be missed on a mammogram. So while mammography is the gold standard for screening, we recommend supplemental screening with either ultrasound or MRI. If you have certain risk factors and meet a certain risk threshold, it may be that an MRI is better for you, or may be recommended in addition to the mammogram. Supplemental screening with ultrasound is something that is being increasingly offered. Um, and it may be that during your mammogram, if you find that you have dense breasts, you can at that time ask for an automated whole breast ultrasound or supplemental screening with whole breast ultrasound. That's something that may be easier to schedule and easier to ask about at the time of your mammogram, at least.
Thank you. And we're getting a lot of questions about family history and genetics. When should women think about genetic testing? When should they consider it? How should they go about getting it? I don't know if you want to speak to that, Katrina or Dr. Mohan.
Um, so women of average risk to start with screening mammography at age 40. If there are risk factors, like we've been talking about, like family history, doing a risk assessment, I think, is an easy thing to do. Like I said, there is a risk assessment calculator on our Brem Foundation website. And just so even putting in some information about yourself and seeing what that assessment tool tells you is a really good first step. And that can maybe help to indicate to you if you need to start doing those screening tools earlier. Katrina, what do you think as well?
Yeah, I agree. For me, it was after the diagnosis that I got my test. And that was just, my doctor saying, hey, I'm going to do one. And I'm like, I don't even know what that is. So I think it's the importance of knowing what it is and knowing that the option is out there to do and what to do, as well as counseling for it as well, is the importance also.
Wonderful. I'm here dealing with the different questions coming on in different places. One person is asking, breast cancer is not always a lump, so how do we make sure we are not missing anything outside of annual mammograms? Annie, you talked about self-check. Do you want to take that?
Yeah, I'd be happy to. I think that that is why a self-check is so important because once you get to know your normal, like if you are keeping up with it every month, and again, make it, it doesn't have to be formal. If you're thinking, oh God, I haven't done it in a while, I'm in the shower, I'm just going to feel around. When you know what is normal for you, you're going to know when something is abnormal. I feel like people think we're so afraid of missing something, but if you are checking, if you are going, to see your doctor because that it is only once a year and that is something that does always scare me, but that's why it's so important to check in with yourself. For me, I wasn't doing that because I feel like there wasn't anybody in my face telling me to do that when I was growing up. They're like, yeah, get a pap smear once a year, do this, but no one ever talked about breast health. And I'm so happy that we have these conversations now, because if you have something like your skin is changing, if there's dimpling, if you have like this orange peel thing that can happen, if there is some sort of discharge, if it is just swelling in your armpit because your lump is in there, all of those things, I do feel like you're gonna know. Your instincts, and like I talk about this a lot. There's something with my gut. Not like you hear all the time in social media, but like there was just this fire in my gut when I got diagnosed, of just when I knew that something was wrong. Like my first oncologist telling me he was going to fire me if I froze my eggs. I thought that's not a way I should be spoken to by a doctor. Like this isn't even an open conversation. You're just shutting me down. So it's really about checking in with yourself, getting to know your normal, and following your gut and not letting yourself get forgotten. So when you're checking, if you're checking every month, you're going to know. You're just going to know. So trust yourself and be there for yourself and advocate for yourself so that you know.
Right. It's like if you're checking every month, then you have a basis to be either concerned about or to talk to your doctor about, and you can speak with knowledge about what your body's been doing over the last X number of months, and it adds to your ability, I would hope, to use your voice. This could be for anyone, but I'll start with Andrea. Any recommendations on how to talk to friends and family about their risk and about screening without scaring them?
Yeah, that's a great question. I never want to, scare anyone. I just want people to be aware. Really just, I think just a conversation, like over dinner, over coffee, whenever you're with your friends, I always just, bring up my story or whoever's, it comes up immediately. Like there was a, sorry, I'm like getting my words together. Like an article that may have popped up like in the New York Times, and we'll say like, did anyone see this? Do you know your risk factors? Do you know what that means? Do you know what dense breast means? And I think just having a conversation where people can feel like they can ask, and I know I've had it with family, I've had it with friends. I had it like 2 hours ago. Just someone came up to me and asked me. So, it's just starting a conversation in a very informal way, and making people aware, like you said, without people feeling scared, because it's the more you know, the better, and you don't know what you don't know.
I think that's so important, making sure people know they can ask you questions. I feel like I'm always talking about breast cancer and I'm like, bring it on. I may not have all of the answers, but let's, keep the conversation going. Dr. Mohan, I want to combine two questions here from our watchers about two breast cancer possible risk factors. One person is asking, just to clarify, did Dr. Mohan say that women who don't have kids have a higher risk of breast cancer? And I would add, is it like if you don't have kids before a certain age? And the other question is the link between alcohol and breast cancer. Dr. Mohan.
Yeah, great questions. So, um, again, these are just theories that are being studied. So, one theory that is being studied is a potential link of an increased lifetime risk of estrogen with breast cancer. So, there are additional correlations showing that not having children or not choosing to breastfeed can increase that estrogen risk and then potentially increase your risk for breast cancer. Again, the etiology of breast cancer, developing breast cancer, is multifactorial. And so there's not a proven causation there, but it's just one of the things that's being studied. Similarly, with alcohol, alcohol consumption is a well-established risk factor for the development of breast cancer and other cancers. The Surgeon General last year put out a report um, in regards to alcohol, saying that I think even a drink a day, so even a glass of wine a day, um, could be increasing your risk of breast cancer and throat cancer and other cancers. Again, these are correlations, not causations. Um, and so I guess the recommendation is that keeping your alcohol intake limited and not increasing that. And if you don't drink, then don't start.
Thank you. I noticed a question here about someone who, what if you don't have insurance? How you go about getting a mammogram? Are there places where you can get a free scan? Anyone can jump in here if you have information on that.
Yeah, so that's a hard question. It is a screening guideline, and while those guidelines are different, differently recommended from different organizations, as radiologists, we say that if you are a woman of average risk, you should receive a screening mammogram annually. So going back to one of the earlier questions about what can you do just to kind of protect yourself and advocate for yourself, that's one of the things. Make sure that you're getting a mammogram every year starting at age 40. So other organizations may say differently, but the American College of Radiology recommends that. That should be covered by insurance. And if you don't have insurance, then look into paying for that out of pocket. And I wish I had more information about this too, but there may be potential health plans. I'm not sure if the other women on the call, the other panelists might have some insight into this too.
So I would just quickly say, I think it depends on the age of the person trying to get a mammogram. So, but there are programs like with local health departments or state by state. So cost should not be a barrier. I just want to that's my takeaway. Cost should not be a barrier. There are programs, there's financial assistance, and if it's medically necessary, which if you are symptomatic and if there's been something that's been found you need a screening, it should be covered, and you can work with nonprofits, with people to make sure that it's covered. So not having insurance should not be a barrier.
Great, thank you, Andrea. There are also all kinds of organizations that help with covering some costs or transportation to services or linking people up with entities that can help pay for those things as well. Again, this is going so quickly and we have so many good questions, but I want to give everyone, all of our speakers, a chance to kind of tell all of the viewers here your one or two big takeaways. What do you most want people who have been listening to this conversation to take away, take with them for their own lives or to share with their family and friends? So let's start with you, Katrina.
Takeaway that I would say today, do your self-exams, get to know your body, like Annie said, pay attention, even though it may be hard, you don't want to look at yourself, your body, you're your own best advocate for your own body. And definitely don't be afraid to use your voice. As I always say, I'm loud for many people, and especially my little sister, and I would continue to be that loud vocal for everyone that I need to be loud for. So use that for yourself as well.
Annie?
I would just say, first of all, thank you to everyone for doing this. Remember that the Brem Foundation themselves, point here, they have many good resources and everything on their website as well. My biggest takeaway I keep thinking about what you guys were saying about how to not scare people, and I'm actually fine with scaring people because I have scared friends, people I went to high school with, even my own dad, into saving their lives by getting their cancer detected earlier. My dad had a really rare, hard to diagnose cancer that was diagnosed earlier than it would have been because of what happened to me. Every time I get a message from somebody who I barely know, or a friend of a friend, or even I have a friend from college right now who told me I've been helping her deal with her mom's cancer diagnosis and that she just had never thanked me. I'm so okay with being an example of the worst case scenario with a good outcome because I know that it's luck that I've done so well. The medicine that saved my life came out a couple months before I was diagnosed. There is so much hope, but please do your self exams, get to know your body, advocate for yourself proudly and strongly. Like I said, be cantankerous, be loud, and always, again, use me as an example. 26, no family history, stage 4 breast cancer. Like I was given 3 to 5 years to live. I'll celebrate 10 years this August. So let me scare you into taking care of yourself and saving your life in a way that makes you proud. Like let that fear motivate you because the fact is no one is exempt to cancer. And I wish that more young women would pay attention to themselves and fight for themselves so that we see if it were up to me, if I could scare everyone into no one ever gets stage 4 breast cancer ever again because everybody gets early detected, that's a big hell yeah in my book.
The two of you
And
talking
take
about
and take care of your head too. Take care of your
and
sweet brain.
saving family members. I mean, Katrina saving or giving your little sister the knowledge to be able to live a long, healthy life and stay on top of her health. Annie, you saving your dad's life, literally. Andrea, what's your takeaway?
My takeaway is know your risk. Know your risk. Next time you're at brunch with your friends, go to Brem Foundation's resources, go through the risk assessment, do it all together, and just talk about it and just go through it, know your risk factors, and it could quite literally save your life because there might be risk factors that you weren't aware of. Go through it with your family, talk about it, have that conversation, and bring it up with your doctor if there are things that you're concerned about. So know your risk.
Thank you, Andrea. And Dr. Mohan, finally.
Yeah, I think everything that everyone else has mentioned, super important. Know your risks, do your breast self exams, get your mammograms. I think most physicians want to help and want to be there for their patients. Breast health is a shared effort. And so talk to your radiologist, talk to your doctor, and develop that relationship and most importantly, advocate for yourself.
Yes, get informed, stay informed, advocate for yourself, know your body. These are all very good advice. I want to thank all of our panelists. I could have had this conversation for a couple more hours. So many questions and so many important stories to share. I want to remind everyone that there's going to be a survey you're going to receive after this program. It's going to be on the exit Zoom screen or it's going to be emailed to you. Please take a few minutes to complete it. It's really, really helpful for the Brem Foundation when it comes to planning and programs, improving programs, making sure they're impactful. And now I want to welcome back Claire for closing remarks. Claire?
I am just blown away by all of you. I just want to say first, just start by saying deep thanks to our fantastic moderator and to our panelists. I feel like not only do we learn from each of you, you just all brought such unique perspectives. And every time I sit through one of these events, I do feel like the information that's given can really help people protect themselves and their family and friends. A couple things. We're going to make this recording available to anybody who missed it. So we'll put it out on email and on Brem's YouTube channel. And as we close out the program, Brem wants to provide you all with information on our breast health risk assessment tool, which we talked about quite a bit tonight. It's called Checkmate. You can get it here. You could scan the QR code. But you can also go online to breastquiz.bremfoundation.org. It takes about 3 minutes. You can take the quiz on your phone or a laptop, and it provides you with a personalized list of risk factors that you can take to your next doctor's appointment to start a conversation about your breast health. So please take the quiz, share with your loved ones. Again, huge thanks to everybody for joining us tonight. What a great panel and what a great group of people. So much engagement in the chat. And there are many ways to get involved with Brem Foundation to defeat breast cancer. Please check us out at bremfoundation.org. Be in touch. And finally, take care of yourself and your loved ones. And as we like to say here at Brem Foundation, detect early and save lives. And thank you all. Good night.